Good morning, everybody. Welcome to
Good
the Daily
morning.
Whatever Show. I am Lawrence Winterman.
I'm Dana Dubois. Uh,
Dana,
yeah,
who are we going to be talking to today?
Dr. Amber Hull.
Yes.
Ask me how excited I am about that.
How excited are you?
Really excited.
I'm really excited too. It's exciting that we get to talk to her twice in 1 week. She joined us very
Oh,
graciously on her birthday for our big marathon on Sunday. And she's joining us again today
see
for a
her.
conversation in which I am mostly irrelevant, which is
Lawrence,
fine, which is a-okay.
every
So we'll
girl
be talking.
needs her gay best friend hanging out for the sex talk.
I'm here for the moral support. Yes, as a Gold Star gay with literally zero experience with lady bits or sexual experiences with women, I'm here to love and support and provide moral support. And also comment on the fact that Dr. Hull bought herself a pair of amazing boots yesterday that are seriously so fierce that when we say girl stomp the house down boots, these are the boots that she's going to be wearing.
Ooh.
Stomp the house down.
I either you and Dr. Hull have a deeper friendship than we have. And
Well,
she
she
texted you,
posted
or
it.
I missed a post. Yeah.
We're not like texting on the side, and she's like, girl, what do you think about these boots? I'm like, oh, child, those are you. You need to get those.
Oh my gosh. I love the idea of that. And I'm laughing, Lawrence, because every day during this podcast, since I moved my spot over here, I've been sitting on a hard wooden chair. During the podcast, I think I need to move my office chair over here because I'm fidgeting. And then squirrel, my day begins and I forget until I'm sitting in the chair again. So apologies for the fidget. Um, yeah, it's a hard wooden chair I'm sitting on for
Yeah.
this show. So hopefully I'll remember today and I won't be wiggling so much. I just wanted to acknowledge it and to say to everyone that yeah, we're going to be talking about lady bits, lube, sex toys. I've already warned my teen daughters who will be getting ready for school
Right.
that they may overhear some conversation that, okay with them hearing, but that, not to be surprised. So if that's not a conversation you want to hear, we totally understand. But we do hope you'll stay, especially if you are a woman in perimenopause, menopause, postmenopause, who has questions about sex toys, anything going on with your body. We hope you stay. I have some questions. We got some questions. You're also welcome to submit questions to the chat because
Yeah.
we have, I mean, we have an actual physician with expertise in menopause, women's integrated health, and sexuality here to talk to us. So I want this to be a really frank conversation. And yeah, if this feels like it applies to you, or if you are having sex with someone who you think this applies to, please stick around and learn.
Yes. Excellent. I just also want to acknowledge that I don't know if people have noticed, but Substack rolled out a new feature last night. I'm noticing that as people join, there's a new little silver medallion next to people's names that indicates if you are a subscriber, not a subscriber to Gen X specifically, but just a subscriber at all. And so there's this. I'm not seeing it on the chat on the browser window, but on phone I can see it.
Oh,
And when you click on people's names, you can see what they subscribe to. If they're a bestseller, it shows that they're a bestseller. And if they are a subscriber to anything, it shows, unless I've toggled it to private, it shows what they subscribe to. So
I'm
it's a
not.
really interesting
Yeah.
feature. I'm not sure yet if I love it or hate it, to be perfectly honest. But yeah, if you're joining and you're like looking at your name and like, why is there a weird little like silver Celtic knot next to my name?
Oh,
Uh,
yeah. I see
that
those.
that means that you are a subscriber to something on Substack. So
Very cool. I noticed it on desktop last night as I was doing some like pre-bed Substack work, as one does. that when I was clicking on folks, it was popping up either a like bestseller if they were, and then after that it would show me who they were subscribed to, like subscribe to 12 Substacks, and it would give icons for all of them. So they're obviously emphasizing community. They want to start giving people medallions of pride for being paid subscribers, which, that checks. Substack makes money if the creators are making money. So interesting to note, Lawrence.
Yeah, it caught my eye. I just want to make sure other people are aware of it. Like we have kind of a tertiary mission here at GenX to help people decipher how things work on Substack. As we learn, you learn. So, you know,
Absolutely.
there you go. Um, should we pull Dr. Hull on, or
Let's
do we have other things to talk about before she joins us?
We always have other things to talk about, but I say bring Dr. Hull on
I
because
agree. We
I've got lots of
concur.
questions here. Um, Everyone in the chat. Oh, Christiane, you're saying you don't see it. Maybe it's only rolling out to some folks, like they're
It, it could
A/B
be. I've noticed
testing.
that. Yeah, Substack has a tendency to like pick different server clusters. Christiane, I know you're in Canada, so maybe there's something about that. Dr. Hull, welcome.
Hey, good morning, guys. Can you hear me
Good
okay?
morning. We can.
Wonderful.
Hearing you loud and clear. We're so happy you're here.
I'm so happy to be here. Thank you so much. And girl, these boots.
Those boots,
These are
right?
Oh my
like
gosh.
epic. And they have like a little kitten heel so I can work in them. And I got them at a rummage shop down the street that's like moving this weekend.
No way.
$22, girl. $22.
Amazing.
And
Amazing.
like
Yeah.
fit, like
Right. And they just
awesome
happen to be in
jacket.
your size.
Yes. It was like
Fate.
a Cinderella moment. I was like, if these fit, this is just like, mwah. And, because like sometimes things at ramen shops don't fit. And
Yeah.
I've been trying to shop more mindfully in these
Mhm.
times and, buy recycled things like this jacket, which was another Cinderella moment over the weekend on my birthday. And,
Oh,
Amazing.
yeah,
cute.
really amazing stuff.
Yeah. They look
I
like they're just like that buttery soft leather that you
Yes.
know, you don't gotta break in. They've just already pre-broken in.
Exactly. That's the case with the shoes, and it's the case with this jean jacket too. You know how like sometimes when you buy a brand new jean jacket, it's like a little crunchy and
Yeah.
it's like all
Yeah.
soft and worn. I love it.
Oh my
Excellent.
gosh. This is like a haul video,
Yeah.
right? I feel like we're like one of my kids, and when they get home from shopping, they have to like take pictures of their hauls or they
Mhm.
watch haul videos. So I'm
Yeah.
all here for it. And an essential jean jacket and pair of boots.
Totally.
Happy birthday to you.
Thank you.
It's
I'm
going to
so
be a
much
good
more
year.
fashionable in the fall than I am in the summer. It's true.
Oh my God. Me too. I've been cracking
Better
out the
clothes in the
sweaters.
fall, I think.
Yeah.
Everything's better in fall. That's just the way it is. So yeah, summer pledge drive is over. It's autumn. I
Yeah.
love it. It's a little darker today. I may need to get a second light, I'm noticing, because yeah, the days are getting shorter.
It's true.
Um
I'm so excited to talk to you guys about Lady Bits, and I have like my whole like speaking of hauls, I have a whole haul of like demonstration models and toys and lubes
Amazing.
and all kinds of stuff to talk about. It'll be a little show and tell. So for people who are not interested in that or have small children around or you're, working or whatever, like you might want to put the earbuds in. I'm just sort of putting like the explicit parental, like this is grown folks talk conversation.
Yes. Yeah,
yes.
we'll check the explicit box when we upload this to YouTube. Exactly.
Yeah. Yep.
No. I'm thrilled to be talking to you about all of this. I Lawrence, I feel a little bit like we're channeling you and Fusin doing dirty talk, except not really, because this
Yeah.
is how people should talk about sex. It
Mhm.
should just be like your bodies exist. We're all sexual creatures, and pleasure exists, and we should be able to talk about it, like
Yeah. So I guess
person to
like
person.
one of the things that I see adolescents in clinic. I see, like midlife women, ladies in their like 30s and 40s. I have a couple of patients in their 20s who come to me for like period related concerns. So, like, I think it's a reasonable place to start, just like to start with some anatomy. Are you guys okay with that?
100%.
Okay.
Would love to. And
Yeah.
just for the flow of the show, I will say I've got some questions here for you.
Okay.
But I have a feeling you're going to cover a lot of them if we just let you go. So this is like Professor Hall today. We're
Wonderful.
getting a
Yeah, I'll
list.
spend like a little bit of time teaching, a little time show and tell, and like I'll leave some time at like towards the end for questions. Kind of break it up.
Absolutely. And if you all have questions in the chat, actually, Lawrence, can I put you
Yes,
on
I'm
chat
going to.
duty?
I will man the chat.
Amazing.
My
Thank you.
usefulness here as a gay dude is I'll man the chat for questions.
I love it.
Perfect.
I love it. When
Perfect.
you guys said Auntie Red and the bear the other day, I almost fell out. That was hilarious. Like,
Ye-
yeah,
And we did not make that up. That's all coming from the chat. What's funny is that multiple people started calling us that, like
yeah,
separately.
that's
So
so
yeah, we'll take it. Auntie Red and the bear.
I'm fine with it.
I love it.
yeah. All right. So when I was in medical school, like one of the first classes that you take is gross anatomy, right? So I had this anatomy instructor who was like, you have to know your anatomy. Like if you're going to be a good doctor, you have to know your anatomy. And that is like every single nerve and branch of every nerve and every artery and every muscle and everything. So conveniently, I have a nice little anatomy model here that shows all of the pelvic floor. So some of this is common between men and women. And but mostly it's lady bits. That's the topic of the talk. So importantly, on the outside, ladies have 3 holes. And there are some, like, even PhD educated men who are like, do you have to take your tampon out to pee? The answer to that question is no, we do not. There are 3 holes. There is this one, this little one called the urethra. This is like the equivalent of the hole at the end of the penis where the urine comes out. This one here is the vagina. That's where period blood and babies come out of. And then you have the one in the back, the anus, and that's where the poop comes out. And all of these holes are held in place by the pelvic floor muscles. And I'll come back to that. So if you see this little like yellow guy here, that is the clitoris. But the clitoris goes like back into the body, and I will show you what that actually looks like. So if you're looking from the outside and, the skin and connective tissue is still on the body, this is what we're looking at. Okay. So you have the skin over the head of the clitoris here. This skin should be retractile, similar. The anatomy is actually analogous between men and women. So from an embryologic standpoint, we're all born with the same bits. And then depending on the hormonal milieu during pregnancy, that determines what anatomy that the baby will be born with. And there are some, like when we talk about intersex people, and I have taken care of intersex people in the NICU, where they have what's called ambiguous genitalia, meaning the baby comes out and we're like, and then we have to do genetic testing. But that sort of like complex stuff is really beyond the scope of this conversation. The point is that the anatomy is actually analogous. So on the outside, again, clitoris, you have the urethra in here, the vagina, and then the anus in the back where the poop comes out. But if you take this off and you look on the inside, this is actually what the clitoris looks like. So you see, this little thing actually looks very similar to a penis, and the skin should be retractile over it. Now, you have these wings of the clitoris that go back around either side of the urethra and the vaginal introitus. And then you have even these wings like that go on the outside. So when we're talking about engorgement, right, and arousal, what we're talking about is that this tissue receives blood flow the same way that a erect penis would. So that when the vagina is fully like stimulated and aroused, it actually like blossoms like a flower because all of this tissue becomes full of blood and it's engorged, right? And like that's how you can tell, if you're a person who has sex with women, that's how you can tell that your partner is like aroused enough to actually receive if receiving penetration is on the menu for tonight. You feel me?
I
And
do.
then,
I love this hot pink model. I like to think I'm pretty well versed in anatomy, but I've never seen it shown so clearly before.
yeah, this was a
Like,
very expensive model, and I didn't have this in medical school. And like
right.
some of my urology colleagues, like get all the way through a urology residency and some fellowship and have never like fully understood the anatomy of the clitoris. And the other unfortunate thing when we're talking about like childbirth and delivery, many of our mothers and grandmothers, like episiotomy was just a common procedure back in those days. And like
Yes,
if
that word kills me.
it
Yeah.
kills me too. It's still one of the only procedures in medicine that I just like cringe, because when they cut to like facilitate the baby coming out, they're cutting through the clitoral tissue. And when depending on the quality of the repair, um
That
you
has
may not
lifelong.
experience sensation the same
Yes.
way again after that, because there's often a lot of, even when there's not an episiotomy, there's often a changing of the architecture surrounding the tissue changes that happen when a child is delivered. So in the postpartum period, not only are women experiencing a profound drop in estrogen and progesterone that can actually mimic menopause, right? So it
Yeah.
can cause things like fatigue and depression and vaginal dryness and lack of libido and all of these things. And people are like, whoa, like there's a tiny stranger in my house screaming at us all the time. And my partner doesn't even want to look at me for the next 2 years. Like, what the heck is going on? That's why.
Yeah. Dr. Hall, we're getting a lot of reaction to that comment you just made about the episiotomy often cutting through clitoral tissue, and that piece about depending on the quality of the repair. Um, could you maybe just expound upon that particular piece for a moment in terms of, um, yeah, I mean, I think what you're saying is that after they do the surgical cut for the episiotomy, depending on your surgeon or your doctor, they may or may not be aware that they need to fix the clitoral tissue afterwards as well. Is that right?
So this procedure was done very common historically. It's done less commonly now,
Okay.
uh, because the data has shown that actual natural tearing has a tendency to heal better than a surgical cut. And I have heard from women, because whenever I see a patient in my office, that I always ask, because I do gynecologic exams on a regular basis, I always ask patients, do you have any history of sexual trauma? And, like, how did your childbirths go? Like, not only were they vaginal or C section deliveries, but were there any complications related to that? Did you have an episiotomy? Did you have a first, second, third, fourth degree tear? How was that repaired? And I have had women tell me, like, oh, the first time, it was because they've got kids in their 20s and 30s. I'm seeing midlife and older women. They're like, the first time it was a nightmare. It was kind of like a hack show and it was repaired. But then I went back in after the delivery of my second child, and, there was a lady OBGYN who's trained in this stuff, and she went back and did a revision of the surgery and fixed things. And so I think that there are more and more women, and like at this point obstetrics and gynecology is a heavily female dominated medical specialty, and so you have more women who are like tuned in to the importance of these types of repairs. So, and that's not a knock against my male colleagues. This is just like there is a long history of medical trauma, especially with regards to obstetrics and gynecology, and especially in marginalized populations, and people of lower socioeconomic status and people of color and indigenous folk. And so that's again kind of beyond the scope of this conversation. I just want to acknowledge that a lot of women have experienced trauma. Yes, sexual assault is very common, and also medical trauma is very common. So when we're talking about, getting back to the fun stuff, when we're talking about, play with a partner, whether it's penetrative or not, her receptivity to you may very likely be influenced by her experiences with pelvic floor trauma in the past. You feel me?
Hmm.
Oh, yeah.
Yeah. So, getting back to anatomy here, If we flip this and look on the inside, you have the bladder in the front, the uterus, these are fallopian tubes and ovaries back here, and the large intestine in the back. So all of that stuff. On the inside of the bladder, this is why, so like when people are pregnant and your uterus is filled with a developing fetus and people have to pee all the time, it's because that baby is pressing on their bladder. So don't make a woman who's pregnant hold her bladder. That's not going to go well for anyone. Um, so
Can cosign.
yeah. So, in my adolescent patients, I think it's important to talk about what the inside of the uterus actually looks like. So, you have this muscular, this is like the uterus is just like muscular tissue. That's why, in response to hormones, we get cramping and all of that stuff around the time that we have our periods. And on the inside, you have the endometrial layer, which is here. And this grows in response to estrogen. And then as estrogen increases in the early part of the cycle, then you have like the LH surge in the middle of the cycle, which causes ovulation. And around the time of ovulation is typically when like women are the most horny. So women who are tracking their periods on an app or on a calendar or whatever, they'll often notice like, hey, I'm feeling frisky around the time of ovulation. And that's to facilitate pregnancy. But in the absence of a fertilized egg happening, the egg goes like from the ovary, which is kind of like here, through the fallopian tube, down through here. If it's not implanted in this nice, rich, lush environment of engorged endometrial tissue, then the egg passes through and the uterus sheds its lining. And that's what we call our period. And so then the blood comes out the way that I described. So that's that. I think it's also important to know that the bladder has a lot of elasticity. And there's this little triangle shaped area in the back of the bladder. I don't know if you can see it in this model, but it is in the model. That's called the trigone of the bladder. And that's a very highly innervated area of the bladder that has nerve endings that send signals to the brain that tell you that you need to empty your bladder. So all of that is sort of basic anatomy 101. Now, it's important to understand from the perspective of like kind of perimenopausal, postpartum, and like postmenopausal women, all of these tissues on the outside and the inside are lined with estrogen receptors. So let's talk a little bit about hormones. There is a lot of talk sort of out in the ether right now about hormones. A hormone is simply a molecule that is made in the body that is secreted by an organ, goes through the bloodstream to act in a distant location. Okay, so, and yes, estrogen, progesterone, testosterone, prolactin, all hormones, and also dopamine is a hormone, insulin is a hormone, thyroid hormone. You have a lot of different hormones in your body. So often when we're talking about hormones, it's like, oh, I need some testosterone so that I can build muscle and maintain an erection. Yes, and there are all these other hormones in the body. So hormones aren't inherently good or bad. They're part of how our body functions. And we have hormone receptors everywhere in the body. Okay, like we have estrogen receptors in our brain, we have estrogen receptors in our skin, in our hearts, in our muscles, in our bones, and all of these pelvic floor organs have estrogen receptors. So, when we're talking about midlife women, as our estrogen levels start to decline, we can get things like brain fog and moodiness and poor sleep and vaginal dryness and decreased libido and leakage when we pee and, all of these things. But as it comes to the lady bits, the lack of estrogen in the vaginal walls actually results in a decrease in blood flow to that tissue. So you get less cellular turnover. the cellular architecture starts to diminish. So it causes things like narrowing of the vaginal canal, decreased hyaluronic acid, collagen, and elastin. So you get decreased lubrication, decreased elasticity, pain with sex, discomfort, dryness, and just like sometimes just an awareness of like, I can feel my vagina. Whereas, like, when you were in your 20s, it's like you didn't even clock that it was there. And now it's just sort of like an awareness, even if it's not like true pain or discomfort, there's just sort of like an irritation and like an awareness that it's there. It's incredibly common for me to talk to women and be like, "So how's your libido?" And they're like, "What libido?" Or like, "Are you peeing a little bit when you like sneeze, cough, or laugh?" Yeah. Or when I run, and if a man went in and said that to a doctor or a urologist and was like, "Hey, doc, I'm having a hard time keeping it up. Like, sex isn't really working for me, and I'm peeing a little bit whenever I sneeze, cough, or laugh." The doctor wouldn't say to him, "Oh, that's just part of aging."
It would be a national emergency.
Right.
Yes. Which is why we've had Viagra on the market as one of the most blockbuster successful drugs in human history, and we would never dream of taking that away from men. And some men would be like, I'll take my chances with, cancer, cardiovascular disease, or whatever. Like, this is a really important part of my life. And yet, for women, historically, it's been like, nope, that's just part of getting older. That's just how it is now. Like, welcome to menopause. And it's like, no, honey, it doesn't have to be that way. So, in addition to the vaginal walls being lined with estrogen receptors, the urethra is also lined with estrogen receptors. So, you get that same sort of like irritation, drying, decreased cellular architecture. And like, I've actually seen like postmenopausal women who have had no vaginal estrogen that actually have like a protrusion of the urethra down, and they can get what's called a carbuncle, which is like a little sort of like cherry shaped, like vascular lesion on the outside of the urethra, sometimes to the point that I can't even get a speculum into the vagina because the carbuncle is like so irritated. Yeah.
Wow.
Yeah.
Oh,
So what's the solution to all of this? Everybody again is talking about hormones, and yes, like I am a big proponent of systemic estrogen and progesterone for patients who want it and don't have contraindications. And, that is another topic that's beyond the scope of this conversation that I could talk more extensively about. But, from my perspective, as someone who's had 3 fractures before 45 years of age, bones are always top of mind. So estrogen's important in the like turnover of bone and like the maintenance of healthy bone and skeletal muscle. But even for women who can't or don't want to be on systemic hormone therapy, vaginal estrogen can treat these symptoms, what we call genitourinary syndrome of menopause. Okay. And there are a variety of different like ways to treat that. We can do inserts, we can do creams, we can do a combination of those things. And for women who have been deprived of hormones and are sort of like later in the life in their, 50s, 60s, 70s, 80s, they can have vaginal estrogen and the labia will actually grow back. Like, I've seen older women whose, like, the inner labia, the, labia minora on the inner side of the 2 lips actually atrophy to the point that it almost becomes flush with the perineum. I've seen women who the skin over the head of the clitoris has actually fused in the absence of estrogen. Yeah. And when we put these ladies on topical estrogen, their labia can grow back,
oh my
their
gosh.
adhesions can diminish. Like some women actually require surgery to break the adhesions over the clitoral hood. But in the majority of circumstances, women's symptoms of dryness, pain with sex, urinary symptoms, vaginal and labial atrophy, that stuff can be successfully treated with regular use of vaginal estrogen. So, if you are a person who wants to have sex and is having discomfort related to that for vaginal and urinary reasons, talk to your doctor about vaginal estrogen. And there are generic formulations that are quite affordable, both in the United States and Canada. Okay.
Dr. Hull, we've got a couple of questions in the chat. So Andrea asks, can this lack of estrogen be the cause for increased pelvic and vaginal pain from interstitial cystitis?
So, interstitial cystitis isn't really my area of expertise. And often it's a multifactorial condition. Depending on the age of the patient, I would say if they're like 40s or older, it's worth a conversation with your doctor about the utility of vaginal estrogen. And honestly, like, I just think that every woman for her 45th birthday, sometime sooner, should be like, welcome to the club, sis. Here's your vaginal estrogen. And think of it as like a multivitamin. Right? Like,
Right.
just like you use sunscreen on your face so that you don't get wrinkles, or, some of us get Botox, or, like you use your high hyaluronic acid and you brush and floss your teeth so that you don't have this deterioration in the function of your body. I think of vaginal estrogen the same way. So pretty much like 80% of women will meet criteria for genitourinary syndrome of menopause at some point in their life. And I don't want to wait until their labia have atrophied and, things have gotten sort of like dry and shriveled before I start treating them. I treat it preventatively. So going back to the question of interstitial cystitis, those tissues are responsive to estrogen. So it stands to reason that the patient could benefit from the treatment of vaginal estrogen. Is it going to resolve the condition? I wouldn't expect it to, but it could certainly be an ancillary treatment in that condition.
Dr.
So,
Hall. Oh, sorry. Can I,
sorry. I just wanted to ask a follow up. So Tracy asked something.
yeah.
You had mentioned contraindications, and Tracy's asking a question regarding that. She says, "Can topical estrogen be used if you've had clots?" And then she says, "Probably not, huh?"
No, it actually can. So the data has shown that what the study that they did was that they took postmenopausal women whose like estrogen levels were vanishingly low, their systemic estrogen levels were vanishingly low, put them on vaginal estrogen, measured their systemic estrogen levels before and at the end of the study. There was a rise in the systemic levels of estrogen, but it was not statistically significant. So there are even conversations, because one of the contraindications to being on systemic estrogen is a breast or gynecologic cancer that requires chemotherapy. So those patients shouldn't, especially if it's an estrogen responsive tumor, can't be on systemic estrogen. And also, when people are on aromatase inhibitors, it causes profound like drying and irritation of the all of these tissues, right? And there's even been conversations between gynecologists, menopause specialists, and oncologists about the safety and utility of putting cancer patients on vaginal estrogen because the rise in systemic estrogen levels is so vanishingly low. So again, like, these are questions to have with your doctor, but it's worth a conversation.
I'm-
Good
I
question.
Tracy has said, I'm so happy to hear that. And me too, Tracy. Um, I wanted to ask a question and also to say thank you. I love what you said about the 45-year-old club,
Mhm.
that it should just be like, here you go. Like, nobody did that for me. That
Yeah.
like hormone therapy is something I very much had to like go beg a naturopath for pretty much like, oh my God, everything is foggy and my joints feel like they weigh 1,000 pounds and
Mhm.
I can't function. And finally, did get hormone, but I love the idea of it just being a norm at 45.
Yeah.
Here's a question with that. If a woman is taking systemic, um, estriadiol and progesterone, is it contraindicated to also use the intervaginal one? Or can you be on both?
You
That's one
you
of the
can be
questions
on
here.
both, and I would argue that one should be on both, because
Okay.
even for people who are on systemic therapy, there's not like really adequate absorption into the vaginal tissues. So most patients that hit my door that are like, you know, doc, I want to be on hormones, talk to me about hormones. We have a conversation about risks and benefits. It's Hormone therapy is not a panacea. There are some patients who have intolerable side effects. There are some patients who have contraindications. There are many women who just don't want to be on hormones. And that's not only true of menopause hormone therapy, it's also increasingly true of the birth control pill,
Birth control. Yeah.
which again is a conversation that's beyond the scope of this discussion, but one that I'm planning to run on my Substack, which is Under the White Coat. So if your audience isn't familiar with my
Oh
Substack,
gosh, yeah, we
Under the
never
White
put the
Coat,
link in there. To
Yeah,
go
yeah,
grab that.
I'll grab it, Dana.
Okay, thank
yeah,
you.
um,
Yeah,
but yes,
absolutely. Go follow Dr. Holt. Like, stop what you're doing right now and go follow because follow, subscribe. I became a paid subscriber over the weekend. Like, so much good
thank you.
information, obviously, over there. So I I love what you're doing on Substack. I love this conversation we're having today. And I'm going to stop talking so you can go ahead.
Yeah. So to answer your question, yes, vaginal estrogen, I recommend for, when patients come in and I put them on systemic hormone therapy, I also in general recommend vaginal estrogen, either preventatively or to treat the symptoms that they've got going on because like I said, the majority of women that I talk to, whether they've given birth or not, are having some degree of urinary symptoms and some degree of vaginal dryness, plus or minus often plus decreased libido. So I'll use that as sort of a dovetail to talk a little bit about libido.
Yes.
It's incredibly common for midlife and older women to have a decrease in libido. And I think of this in terms of people who are in science or in the social sciences have heard of the biopsychosocial model of, addiction and libido and these sort of like behavioral things. So when we're talking about libido, question number one is, are you having pelvic symptoms? Because if things are dried out and irritated and, you're worried about odor or leakage and those types of things, well, of course, you're not going to want anybody going into your pelvic area. Like, you know, that is sort of like question number one. So vaginal estrogen, check that box. If you're like from a psychological standpoint, if you're depressed, if you're anxious, if you're not sleeping, which is also a very common symptom in midlife and postmenopausal women, if your kids are driving you nuts, if you are having a hard time paying your bills, if the geopolitical situation is causing you to like incessantly doom scroll, like all of these things contribute to a psychological environment that makes it difficult to drop out of your head and really drop into your body. And like that drop
Mm,
your body is where the magic happens with respect to intimacy.
yes.
So there's the biological and the medical, right? And things like diabetes and cardiovascular disease and cancer and hypothyroidism and like all of those medical things, even just being sort of like metabolically out of sync can affect your libido. The psychological things and your time and your stress and your job and all of that can affect your libido and also your connection with your partner, right?
Of course.
And I put an asterisk on partner because midlife is often a chapter of very profound change for folks, right? Like I have women, excuse me, and friends who have recently gone through divorce, for example, or they were in a sexless marriage for years and, they get out of it and they're like, all right,
Let's
it's time,
go.
like Stella got her groove back. It's time to make up for lost time. And they're like, I, am not interested in a long-term, partnership with domestic labor and, childbearing and all that stuff. I want to play with younger people who have stamina and nice abs, and that's fine. Right. I talk to ladies who are in their 70s who still have really nourishing relationships with a partner that they've been with for decades. I have ladies in their 70s and I'm like, girl, how's your libido? And she's like, 8 out of 10. And I'm like, awesome. Do you have a partner? Like, what's going on there? And she's like, nope, I take care of myself. It's less hassle and I am totally satisfied. And, regardless of whether
Girl,
someone
go.
has, what's that?
I said, girl, go.
Yeah.
In her
Yes.
70s. I saw you post about her on Substack and I was like,
Yeah. Like goals, right?
yeah.
And regardless of whether someone has a partner or not, um, like I'm a proponent of self-love and toys for that reason. Like to me, libido is about vitality, it's about confidence, it's about how you carry yourself in the world. Like I like low key can clock in couples like if they're in a sexless marriage just by how they interact with each other and other people around them. And maybe it just like that just has to do with experience. Um, but there is a sort of like confidence in how one moves through the world as a result of their sexual gratification and prowess. Do you feel me?
Yeah.
So
Yeah.
that's where I think, and when I write about these things, I write about intimacy in a way that respects people's dignity and also recognizes that libido wax and wanes through seasons of life. And there may be chapters in, especially in long term monogamous relationships where, you know, sex and intimacy take a back seat or it just looks different. Right. And like, how do we process that? And so I'll dovetail a little bit into kind of toys and lubes and things that can facilitate intimacy. Are you ready?
I'm
Dr.
ready.
Holmes, can I? So there are a couple of questions that I've been holding on to here just
Mm-hmm.
because, you're on a roll, which I love, and this topic is incredible. But if we could step back for just a second to maybe
Yep,
answer some questions from the chat.
totally.
Um, so Andrea asked, which is better, tablets or cream, in terms of the vaginal estrogen?
Okay. So this is a good question. And it's been interesting, like coming to Canada because the products that are available are a little bit different. And when I was in
Mm.
the States, estradiol cream, like 0.01%, just like generic cream, is available. It's only available by prescription, and a month's supply is like $15. So you can get it at CVS. In the UK, it's my understanding that you can get it over the counter. In Canada, the vaginal creams that are like commercially available are like forms of estriol, which is a bioidentical hormone. So our bodies make estradiol, estriol, and estrone. Estrone is actually can be pro-inflammatory, so we like estriol and estradiol. But the commercially available creams in Canada tend to be estriol. I like 17 beta estradiol because it is more like it works better. So here in Canada, there are a couple of inserts. One of them is Imvexi. It's an ovule that you insert digitally into the vagina like 2 or 3 times a week, and it dissolves. I recommend that ladies use it at night before they go to bed so that if there's a little bit of residue, it doesn't bother them. Vagifem is another insert, but the creams are all versions of estriol. So when I'm prescribing those medications, it really depends on the extent of the pathology. If I'm doing it sort of like preventatively, I usually will recommend an insert because in terms of like adherence to the medication, it's some people don't like creams, and the creams available in Canada, in my opinion, are not quite as efficacious as estradiol. In the States, the creams are, you know, inexpensive. You can use them. Some patients are just like, I don't like this cream. It's yucky, or like I get a yeast infection, or I just don't like putting it on. In which case, the inserts are a good option. So it really is up to like I have that conversation with the patient, and I'm like, this is the menu. Which one do you think that you'll use? Right?
Okay.
But you
And
feel
then
like they're pretty equally effective in terms of treating symptoms?
Yeah. Yeah.
Okay. Good to know.
Lisa NRN is asking, I think related, is BHRT pellet therapy better, worse, or the same as a cream?
So I am not a fan of pellets. The reason being is that once you put them in, you cannot take them out. So you're sort of like you're thrown on this roller coaster, and girl, you're not getting off of it. And, some people have really difficult side effects when it comes to hormone therapy. And I've had patients who are just like, their anxiety levels go off the charts, or, they're crying all the time, or, their breasts are so tender that they can't hug their partner or kids. And, when it comes to testosterone, which is a whole other different conversation that you can come follow me over on my Substack and I'll go into. But when it comes to testosterone, these pellet clinics are putting pellets into people, and like the side effects can be things like hair growth and clitoral enlargement and irreversible
Oh,
voice changes and, things that you're just like, I don't want to be on this roller coaster anymore. And so for me, I prefer like the FDA approved bioidentical hormones. And I think that this warrants an explanation of what the term bioidentical means. Bioidentical simply means that the molecular structure of the compound that you're taking in the medication is an exact image of what, or it exactly mirrors what you make in your body. So there are FDA approved formulations of bioidentical hormones. You don't have to get a compounded or pellet medication for it to be bioidentical. I feel like I should stand on the mountaintop and say, like, there are FDA approved medications for this, and my choice, unless a patient can't tolerate a standardized dose formulation, is to go with FDA approved medications because the compounded and like pellet formulations are not FDA regulated. So you really don't know what you're getting. And there can be batch to batch variability, or if it's in a bottle, you can have like it's more concentrated towards the bottom of the bottle than it was at the top. So you're getting a different dose. So when I'm writing these prescriptions, I write for FDA approved formulations of bioidentical hormones. A topical transdermal estrogen, usually with an oral micronized progesterone, is kind of my like starting point. And I can, and obviously it's tailored to the needs of the patient, but I'm not a fan of pellets. And there are many in the medical community who see them as a cash grab that puts patients at risk.
Wow. Okay.
that's
And
super helpful.
we've got one more here. I want to be mindful of time, and I know the libido conversation is really important. But Cheryl is asking, I've recently started having flashes again, 27 years later. Can perimenopause cause breast cancer? I was told this by a doctor.
Perimenopause, or it was a different word, I think.
Uh,
Was it?
Premarin. I'm sorry. I thought that
Oh,
was
Premarin.
abbreviation for perimenopause. Premarin.
Okay. So in the Women's Health Initiative study that came out in the early 2000s, they had taken groups of like ladies in, I want to say, their 50s, 60s, and 70s. Many of the patients were in their 60s and 70s and had, comorbidities, including, many of these patients were smokers, which puts people at increased risk of cancer and blood clots just by virtue of their smoking risk. And we're also increasingly recognizing that alcohol does those same things in terms of increasing risk of cancer and bad things as we age, cardiovascular disease, hypertension, what have you. So Premarin it's a conjugated estrogen derived from pregnant mare's urine. Premarin. Got me?
Whoa.
Got it.
So
Yeah.
the
Okay.
medications that they were giving people in the Women's Health Initiative study were conjugated like synthetic estrogens. This is like where the whole conversation about bioidenticals came from. So in those studies, they were seeing increased risk of things like clot and like cancers and things like that. But the medications that they were using at that time and the patient population that they were studying are not the medications that we use now. And we're recognizing increasingly that the ideal window to start people on hormone therapy is within 10 years of the last menstrual period. Right. So ideally before age 60, although I'll still have conversations with ladies in their 60s and even in their 70s about hormone therapy. So does Premarin cause cancer? No. There's that conversation about the data in the Women's Health Initiative, again, is like a whole other thing that's kind of beyond the scope of this talk. But that's where that sort of myth came from.
Did immense harm to menopausal women everywhere.
Yeah.
Um, we are going to have very little time for the fun stuff, and we may need to move our October talk to talk more about toys and lube. But can we take, how much time do we have left? 10 minutes, 11 minutes
Yeah.
Yeah.
to get to the
So
fun
I'll
stuff?
talk a little bit, and we'll start with lube because that's kind of like the friendliest stuff. So for people who are experiencing vaginal dryness and vaginal estrogen isn't the kind of thing that's like you're going to take it tonight and by next week it'll make a difference. Like you got to really be consistent about it and you'll notice a difference within a few, weeks or months. In the meantime, this is my favorite lube. This is Uber Lube, right? And if you're a clinician, you can actually reach out to them and they have a program where they'll provide samples for your patients for you to keep in the clinic. This is a silicone-based lube. So you have your water-based lubes. Good Clean Love is one of them. This is like marketed as being organic and pH balance. Water-based lubes tend to require reapplication. I like silicone lubes because they have like amazing staying power, whether we're talking about vaginal or anal or toys or fingers or body parts. Like silicone lube sticks around. She is your friend. And there are also hybrid lubes that you can get that are a combination of a water and a silicone based lube. I am sort of a rebel when it comes to the, I guess, what I would call mythology if you can't use a silicone-based lube with silicone toys. Like, if you're good about washing your toys after you play with them, I, am fine with using silicone lube on silicone toys. And also, I recommend using condoms on toys to help them stay clean, especially if they're going into someone's butt or especially if you're using the same toy on multiple partners. Condoms over the toys, silicone lube, those are your friends. Um,
So can I can actually contribute here as a gay dude who has silicone toys. Another thing is wrap your toys individually in a cloth because silicone toys often, especially if you're using silicone based lube, if you rest them against each other, they weirdly melt into each other. So
yes.
it's important to kind of wrap them individually and keep them clean and dry and safe and individually wrapped.
Yeah.
Lawrence, I love how you're
Absolutely.
like, I have something to
I can
contribute.
help. I can help.
Yes. And that's a really important point because sex toys aren't cheap.
Right.
And that brings me to my favorite. So, the majority of women require clitoral stimulation in order to achieve orgasm. And so, if someone's sort of like sexual skill set just includes a little bit of like tongue flipping and a jackhammer, like don't be surprised if your partner doesn't get there. Unless you do the tongue flipping and like fully get her off before you start with the jackhammering, that might work. But the Rose is my favorite. This is a suction vibrator, a clit stimulator, and my partner, fortunately, is like anything that makes my girl go sploosh is a bro. So for guys who are sort of like threatened by the concept of like using a toy in conjunction with penetrative intercourse, like these are your partners in crime. They are not your replacement. They are not your enemy. Um, Clit stimulators can be very helpful for women who have trouble achieving orgasm, or if where I'm sort of like generalizing to heterosexual folks because they're most of the population, that if ejaculation happens before the female partner achieves orgasm, like the male partner still has a responsibility, in my opinion, to get her off. And that's going to encourage her to want to engage with you the next time around. And clit stimulators can be very helpful when it comes to that. One of my most recent favorite purchases is this little thing. This is a feather and it vibrates. This
Ooh,
is an amazing toy. It was kind of a little bit of a stretch. I wrote about this in an article on my Substack called
I'm
My
grabbing that link. I have that link right here. In
Yeah.
fact, I'm just going to put it in. I was writing why you should click it, but it's the one that's called My Favorite Toys Not Safe for Work, right?
Yeah. Yeah.
Yeah. And all
And
the lube recommendations were in there too, correct?
yep. Yeah.
Okay. Y'all bookmark this one. I just put the link in the chat.
So I love this little thing because it really, again, when we're talking about like dropping out of your head and dropping into your body, for me, whether I'm the person delivering the stimulation or the person receiving the stimulation, it helps me drop in to the other person's experience. And for me, like really gratifying, intimate experiences, again, they're about connection. It's about vulnerability. This is about being seen. It's about having my partner pay attention to what's happening in my body and me paying attention to what's happening in theirs. And for me, it's almost like a flow state or like a meditative experience. right? And I think that's where the true, like, magic and, like, spiritual connection, whatever that means to you, of having a really nourishing, intimate experience. Whether it's a partner that you've been with for decades or someone that met on Tinder, the ability to sort of, like, drop out of your head into your body and, like, really pay attention and see another person is what it's all about. And this thing, I'm telling you, and I'm not getting kickbacks from this on this toy.
You
I
should
love
be.
this thing. Yeah. Um,
How does that one work? Does it vibrate?
yes, it vibrates, but it has a variety of different, like, you can take it and just, like, go across the muscles of the face, or, like, go across the lips, or, like, around the ears and down the collarbone and, like, around the clavicles, like, and you can use the tippy tip of the thing. You can place it flat while it's vibrating and go across different parts of the body. This is a non-penetrative toy that provides a lot of stimulation. And when you're thinking about, again, like, engorgement and, like, driving blood flow into the pelvis, think about, like, driving all of the blood flow from everywhere else in the body, including the feet, up. And if you consider your, like, foreplay, so to speak, as driving blood flow to the pelvis, this is an amazing toy.
I've never seen anything quite like that one. So
I hadn't either, and I have an arsenal of toys, and that, my friend, is one of my favorites. I know we're running low on time. I mean, I have
I'm very
ranted about
happy you're
other
coming.
toy.
Yeah.
Um,
We already have another visit with Dr. Hull booked in October. I think we have a different topic for that, but I think we may need to dive in a bit more to your toy arsenal
yeah.
in October because we want to be mindful of your time. I know there are real life patients waiting to see you today. Um, where are we on time? Yeah, we have 3 minutes
3 minutes.
left.
Yeah.
Okay. Do you wanna field another question, and then we'll kind of, like, wrap it up?
Um,
I know there's a lot of giggling going on in the chat, and like, I think about this and, like, coming on your show because I know that you guys, you talk about politics and culture and dating and all this stuff. Like, I think of myself as sort of being like Dan Savage in the back pages writing Savage Love in the 80s, and I'm like,
Yeah.
doing
yes.
like, that's how I'm like, "Oh, I'll be like the sex medical expert coming on and talking to you guys and fielding questions."
It's so important, and I thought of Dan Savage when you were talking about the vibrator and how some men don't like it, that he always says, like, "You wouldn't ask a carpenter to go build a house without a hammer.
Yeah,
The house is still built and he built it." So, you get your woman off with a toy, you're still doing the work. You just have a
right.
tool.
Yeah, and
Um,
when I see patients in clinic who, like, their primary concern is like, "Okay, like, I'm optimized on my estrogen and progesterone, like, plus or minus a little testosterone to, like, be the icing on the cake, but, I really wanna focus on libido." We have these conversations about biological, psychological, and social, and, like, I saw a patient this week who I was like, "Okay, girl, you need some vaginal estrogen, first of all, and this is why," and I made the case to her because she already had the prescription, she just wasn't using it because she didn't, like, realize the utility of that medication. And I was like, "And you, like, take your partner and go over to Honey's," which is one of our local toy stores here, owned by ladies. It's very femme forward. It's very friendly. Their staff
okay.
is very knowledgeable. I was like, take your partner, go over to the toy store, get yourself a bottle of Uber Lube, and, like, look at toys together. You have permission to read erotica if that's your thing, because a lot of women, like, porn isn't so much our thing, but, like, you give us some dirty literature and we're off to the races. And so I like prescribing those types of things because sometimes I feel like, especially for women, like, the culture of slut shaming and, like, f- you know fidelity and all of these things, like, it really puts a damper on our ability to allow ourselves to experience new things. Whether that is coming out of a divorce and, going on a, sexual exploration journey, whether it is opening a relationship and, like, playing with other people, whether it's just allowing yourself permission to, like, go to a toy shop and explore new things. And, like, kink is a whole other different realm, again, that I write about and is on my Substack and will be continuing to write about. I'm actually thinking about writing a book about that because I think it's important,
Yes.
because kink is so much more than like whips and chains and, dominatrixes with ball crushers, right? Like kink is about vulnerability and honesty and being seen. So with that, I think we're at the top of the hour.
We are, and I think maybe Dana. I mean, I know Dana's right. She's always right. Next time, maybe we talk about the kink in the toy. Maybe that I'm sure that could fill an entire hour, right?
It absolutely could. And I want to thank you so much. And I want to underline something you just said about women not having permission. And I think that it's exponentially higher for older women, right? As we come into perimenopause, menopause, postmenopause, there's a cultural expectation that we just shut down sexually that is simply untrue.
Mm.
And I think the work that you're doing elevates that we're here, we are sexual beings, and there are medical treatments for some issues that you may hit along the way, but that doesn't change the need for connection, for pleasure, all of it. So thank you for being here to help help elevate that as a topic. And please, we are coming back in October already. I don't have to say please come back. I think it's the 16th. We have you slated, so you all go follow Dr. Amber in the meantime. Your page is chock full of information that the whole world should know. Yeah, the sex education we didn't get as kids that we need to get now as adults.
Amazing.
Thank you
Thank
so
you.
much, Dr.
Thank you
Hall.
so much again for having me.
Thank you.
And thank you
Of
for letting
course.
me get on my soapbox and do a little teaching.
We
Oh,
love it. We love
We
it.
loved every minute.
Yes.
And
Wonderful.
congrats on those amazing boots.
Thank you very much.
Yes.
I hope you have a wonderful day. Thank you.
Take care. Thanks, everybody.
Bye. We love you.
Bye.
Mean it,
Bye.
everybody.
Love you.
Bye.
Wow.